Welcome to Maternal Mental Health in Minutes by Motherhood Understood. This video talks about taking antidepressants during pregnancy and while breastfeeding. The most commonly prescribed medications that are low risk while pregnant or breastfeeding are SSRIs, selective serotonin reuptake inhibitors. When considering taking these antidepressants, the decision typically comes down to risk. The risk to the baby versus the risk to mom and her family of not treating the illness. This is called the risk-benefit ratio, and it's something you should discuss with your prescribing doctor. Just like you can find risks for taking medications while pregnant, there are also risks associated with being pregnant and anxious and/or depressed, like low birth weight or premature delivery. Some reasons for why you would want to continue or start taking an antidepressant during pregnancy are: you've had depression, anxiety, or OCD in the past, and when you've gone off your medication, you have done poorly or gotten worse. Going to talk therapy alone isn't helping you feel better. Your daily functioning is heavily impacted by your depression or anxiety. If you already take antidepressants for a prior mental health illness and are planning to get pregnant or are already pregnant, do not just stop taking your meds. Consult with your doctor because it could be beneficial for you to stay on them during your pregnancy. If you took antidepressants during or after your last pregnancy and are no longer taking them now, talk to your doctor about the decision to go back on them as part of your pregnancy plan. Also, just because you are taking medication doesn't mean you can't breastfeed. And just because you are breastfeeding doesn't mean you can't start taking medication. If you are experiencing a postpartum mental health illness and are breastfeeding, don't let this prevent you from speaking up, reaching out for help, and taking antidepressants if they can help you feel well. We know the decision to take antidepressants during your pregnancy or postpartum while breastfeeding is a very personal one and should always be made with your doctor. It should never be made based on feelings of guilt, shame, or stigma associated with needing medication for a mental health illness. There is a ton of misinformation out there about taking medication while pregnant or breastfeeding. Not all medical providers you see during pregnancy and postpartum, including OBs, pediatricians, regular doctors, and many psychiatrists, are trained in perinatal mental health, meaning they don't always know what certain medications can be prescribed during pregnancy and while breastfeeding. This is why it's so important to be well informed so you can be your own mental health advocate, and if available, to be under the care of a perinatal mental health care specialist. The following organizations have perinatal psychiatric consult lines your doctor can call for information and guidance about safe medications that can be taken while pregnant or breastfeeding. The most recent research studies showed there to be no increased risks of birth defects with the use of SSRIs. For more information about safe medication, check out the following resources.